So this is a loading technique to the deep part of the back hip. That covers roughly about the belt line all the way down in through here, either on the left side or the right side. You're going to need a ball and something to sit on top of. You're going to place that ball on top of that surface. Now there's two different methods that you can use. The first one is more of the seek and destroy. So for starters, what you want to do is you want to cross the leg over the opposite one just like that. So you're forming a figure 4. Then you're going to scan that area, trying to find an area that's sensitive. Once you find a sensitive area, you're going to hold that there. We found it, we saw it, now we're going to destroy it. We're going to take a deep breath in, and when we exhale, we're going to add a little bit more load on top until it becomes desensitized. Once that happens, then you can scan another area. So now I'm going through that area, trying to find another spot. I'm going to take a deep breath in, exhale, add a little bit more load right on top of the ball until it desensitizes and melts right over that ball. The second method that you can try is more of the pin and stretch. So you're going to do the exact same thing, exact same setup. The leg's going to cross over the opposite one just like that. You're going to hold it, and then now you're going to scan a sensitive area. So once you find that sensitive area, you're going to pin it down, and now we're going to stretch it out. How are we going to do that? You're going to take the knee, bring it towards the opposite shoulder. So I'm going to add a little bit more weight on top of the ball to pin it down. Now I'm going to bring my knee up towards my torso. My torso will stay stationary while I bring my knee up. And hold that position, and then slowly let it go. And then afterwards, I can find another spot, do the exact same thing. So I found another spot right there. I'm going to load that tissue, bring that knee up towards my stabilized torso, hold it there until it desensitizes. Another method that you can try is instead of moving the knee, you're going to keep that stationary, and you're going to bend at your hips forward. So again, I'm going to find an area that's sensitive. I'm going to hold it right there. And then now what I'm going to do is add a little bit of load to pin it down more. Now I'm bending at my hips. My spine is straight, and I'm leaning forward until I feel more load and more sensitivity. I'm going to hold that there until it melts so I can find another area. So again, I'm going to show you the side profile. So I'm right in through here. I'm finding the area that's sensitive, which is roughly about there. I'm going to add a little bit more load on top. My knee's going to stay there. I'm going to stick my butt out a little bit more so I bend at the hips, and my spine is straight until I feel an additional load or an additional sensitivity to that tissue. I'm going to hold it there until it melts.